Health info. Bringing you well-researched medical information. What is diabetic neuropathy? This is a fictional patient who we will name Mr. Andrew. The story will help you understand how people can experience a certain medical condition in their everyday lives and when they should reach out for medical attention. This story is purely for education purposes. This is in no way a prescription for your medical condition. Please seek out advice from your doctor for any concerns you may have. Mr. Andrew is a happy-go-lucky man who just celebrated his 55th birthday with his family and grandchildren. Although he loves cake, he avoided it as he is a type 2 diabetes patient. He has been managing his diabetes for over 10 years. However, it seems that his blood glucose is not very well managed, and he has an HbA1c level of 9.5%, which is higher than recommended levels. For this reason, he is considered as a poorly controlled diabetes patient. For some time now, Mr. Andrew has been complaining of numbness and tingling in both his feet to his wife. He says that he sometimes gets a burning sensation at night. He feels that he is becoming insensitive to any temperature changes, and says he feels he doesn't feel touch well in his feet either. Sometimes he trips and stumbles, which is making him feel insecure about his balance. His feet are becoming drier, and he is developing calluses on his feet. Physical examination. Dr. Smith carried out a physical examination of Mr. Andrew's lower legs and feet. He noticed that Mr. Andrew was having a decreased response to certain sensations such as light touch, pinprick, and temperature. The feet had lower ankle reflexes, and the feet looked dry and cracked with calluses. He also told Dr. Smith that the hair on his legs and feet had become less than before. While Mr. Andrew showed these signs of having a lower sensation response, Dr. Smith did not notice any infections on his feet or legs. Dr. Smith diagnosed Mr. Andrew as having diabetic neuropathy after doing some other tests and careful evaluations. Because Mr. Andrew's symptoms were mostly on his feet, Dr. Smith deduced it was peripheral neuropathy. Dr. Smith told Mr. Andrew that diabetes patients can commonly develop this complication. In diabetic peripheral neuropathy, patients may have damage to the nerves of the feet, which makes patients feel less sensations. Patients also have lesser reflexes, and they may feel weakness in the muscles of their legs and feet, which was why Mr. Andrew felt unstable on his feet. Management. Dr. Smith advised Mr. Andrew about the severity of his condition and along with the specific care and plan he developed for him, gave him some general advice on how to manage his diabetes and his neuropathy. After careful testing and evaluation, Dr. Smith recommended updates to his medicines and diet so that his blood sugar could be controlled better. He also advised Mr. Andrew to be more physically active so that further damage to his nerves could be avoided. Pain management. Dr. Smith also decided to give Mr. Andrew some medications for his neuropathic pain. Usually, the drugs given in such cases are gabapentin or pregabalin, and the doctor is in the best position to decide if they should be given and how. Foot care. Dr. Smith then educated Mr. Andrew on how to take care of his foot so that he does not develop any foot ulcers. Doctor said that Mr. Andrew should inspect the foot daily to monitor any changes, use moisturizer to prevent dry skin, wear comfortable and well-fitting shoes, and avoiding high-risk activities. Balance and coordination training. Since Mr. Andrews was having trouble maintaining his balance, Dr. Smith recommended that he meet with a physical therapist for exercises to improve his balance and coordination. Regular follow-up. Dr. Smith recommended that Mr. Andrews visit him on a regular basis to monitor and check his progress. Mr. Smith told him that he would regularly check the progress of his nephropathy, his blood glucose levels, and would advise further based on his progress. Mr. Andrews felt sad and worried after hearing about his new diagnosis. But his doctor and family assured him that they would all work together to help him manage his condition. Mr. Andrews understood that he is responsible for his health and care, and he should therefore follow his doctor's advice. Conclusion. Patients diagnosed with diabetic nephropathy should consult their doctor to find out the progress and severity of their condition. The doctor would then help the patients by educating them and treating them according to the individual case of the patient. Regular visits to the doctor and following proper foot care and healthy lifestyle would help patients deal with diabetic nephropathy in a more confident way.